Hello everyone, my name is Dr. Shabri Hassoor. I'm a GP and physician in southwest of England. I'm also the medical director of Adisha Health. My father was the most kind and loving person I have ever met. He was like a rock beside me, was there to support me when I fail, to celebrate when I achieve. Unfortunately, we lost him in October 2021 to dementia. Dementia as a disease had a significant impact on his health, personality, and overall life, especially towards the end. It had a massive impact on us family as well, in terms of emotionally, physically, socially, and financially. My parents lived in India 10 to 15 years ago when the diagnosis was made. There was very little awareness or support. In his memory, I have created this dementia awareness video in the hope that it is going to support families whose loved ones have started showing symptoms of dementia. So let's start with what is dementia. Dementia is a set of symptoms. It is caused by various diseases which causes brain damage, which eventually causes problems with memory, planning, organization, language, and behavior. It's a chronic progressive neurological disorder which doesn't have a cure at present. So how common is dementia? 900,000 people live with dementia in the UK, out of which 42,000 people have got young onset dementia, which means the symptoms started before the age of 65. 8.8 million people have got dementia in India, and it is more common in females. So what are the types of dementia? There are four main types. The first one is Alzheimer's disease, which is the most commonest. The second one is vascular dementia, and the other two common ones are the dementia with Lewy bodies or the frontotemporal dementia. So what are the risk factors of dementia? Obviously, the advancing age is a risk factor. It is more common in women. The risk factors, cardiovascular risk factors, are also risk factors for dementia, like diabetes, hypertension, atherosclerosis, hypercholesterolemia, if they are smoking, if they are taking alcohol more than the safe limit. If someone has got less cognitive reserve, which means they're doing simple jobs or they have left education early. Also, the other risk factors are deafness, traumatic brain injuries, depression, and other chronic medical conditions like chronic kidney disease or HIV, rheumatoid arthritis, etc. So what are the symptoms? In early stages, people might start experiencing memory problems, especially short-term memory loss. They have problems with concentrating, planning, organizing. They might have problems with language and communication. They might have problems regulating their emotions, perception problems. Also, they can get disoriented with respect to time, place, and person. In later stages, especially, for example, mobile dementia patient, they can go off wandering. They might exhibit aggression. They might lack insight into their symptoms. They might have sleep problems and also delusions. All in all, the symptoms can be quite distressing to the patient as well as the family or the caretakers. A small note about the young onset dementia. A dementia is called young onset when patients start having symptoms before 65 years of age. Normally, various diseases are the cause of young onset dementia. They normally tend to have rarer types of dementia. Less likely that the memory loss is the first symptom. More likely they might have problems with walking coordination. And 10% of this young onset dementia are inherited. And generally, these patients are young and they do not have other chronic medical problems like diabetes or rheumatoid arthritis or HIV, which we discussed earlier. So how is dementia diagnosed? Initially in the primary care, we tend to do screening blood tests to see whether there are any reversible causes of the symptoms the patient is experiencing. Then we organize a CT scan of the head, which are specifically, to diagnose dementia. Also, we tend to do cognitive tests, which are simple ones. Once in the primary care we do all these tests, we tend to refer patients to memory clinic where more extensive assessments take place, and they confirm the diagnosis and the type of dementia, and they initiate treatment. So what treatment options are available for dementia? Now, I'm sure me and other clinicians who are involved in the care of dementia will say the first and most important thing is it has to be patient-centered treatment plan or a person-centered treatment plan. There are medications which are used in dementia. There are non-drug therapies. The non-drug therapies are art therapy, music therapy, pet therapy, keeping the environment calm and familiar, etc. So coming to the medications which are used in dementia, there are various classes of medications which are used, but the most common one is the anticholinesterase. Examples are donepezil, galantamine, rivastigmine. These will inhibit the action of the cholinesterase, breaking down the acetylcholine, which increases the amount of acetylcholine which is available for the neurotransmitter action. The other one is the NMDA receptor blocker like memantine. They can also, depending on the symptoms of the patient, they might also need antidepressants, antipsychotics, anticonvulsants. And again, as I said, depending on the symptoms the patients exhibit, then there will be medications which are issued according to that. Counseling is also a very important part of the dementia treatment for patients, for families, and also the carers who are looking after patients with dementia, because it can get quite hard towards the end. During the end stages, the symptoms can be very distressing, as I mentioned before. So the take-home message is be aware of the symptoms of dementia, get an assessment and diagnosis early from specialist clinicians, be patient with patients who are living with dementia, initiate the advanced care planning early, and safeguard them and care for them with love and affection. We as a family in the UK, we have been organising charity events to raise funds for Alzheimer's UK in the last 3 years. And this year it was an Indian Lunch charity event. Thank you for listening.